Look at the real camera. Okay. Why don't you tell us who you are and what you do for a living?
My name is Wade Tillotson. I am a doctor of physical therapy down at Arroyo Grande Acute Rehab Unit, and I got my doctorate in physical therapy from Chapman University back in 2006. I've been practicing for almost 12 years now.
Okay. So we were talking about people who have experienced strokes and their rehabilitation process a little bit. And that's something that interests me. It worries me that we live in a disposable society that treats things so much like if they aren't functioning normally, then we should just throw them out. And what does that say about how we're going to treat people who may not function up to the norm? So, along those lines, I'd like to ask you about people who have experienced a stroke and what sort of biological aspects of that problem are pertinent in terms of rehabilitation tools.
Okay, so when someone has a stroke, it is either a blockage of an artery or that causes nerve damage because the nerves need oxygen, need blood supply, or there's actually a bleed in the brain which can cause nerve death also. And when those parts of the brain are damaged, they're not coming back. And what has to happen is there's a term called neuroplasticity, which means that the brain is actually able to change depending upon what kind of inputs and what kind of learning it does. So with stroke rehabilitation, our job is to utilize neuroplasticity in order to teach the surrounding areas of the damaged areas of the brain how to work and help out and take over the roles that were lost.
Okay. Okay. So, in rehabilitating someone that has experienced a stroke, what sort of design choices are made in creating devices to help them relearn walking or other activities?
Okay. So for assisting the physical therapist in helping someone relearn how to walk or ambulate, a repetitive motion is necessary in order to provide the stimulus to the brain in order to retrain the feedback loop for the person to relearn how to walk. We have a few different tools at our disposal in order to do that task of repetitive motion in order for the person to relearn this task. One of which is the body weight supported treadmill system, which supports the person and provides the therapist an opportunity to move their limb for them. Unfortunately, this creates a problem for the therapist because we have to manually move the limb for every step in order to provide that repetitive motion. Another choice that is becoming more and more prevalent is the exoskeleton. What the exoskeleton can do is provide the repetitive motion and the movement of the limb in order to free up the therapist's hands in order to provide more of a therapeutic cueing and to really help the therapist provide more of a skilled intervention in order to help the person relearn how to use that limb and how to retrain them to ambulate more efficiently.
Okay, and lastly, I'd just like to ask you, as someone who works in the physical therapy field, what sort of societal impact do you see devices like the exoskeleton or even the bodyweight treadmill having for people who are going through physical therapy?
So the exoskeleton specifically has a multitude of different uses that anywhere from providing people with the ability to walk again with the use of the exoskeleton in the community, which would return them more to a normalized state that they might be used to from previous to the injury. As far as rehabilitation specifically with individuals who have had a stroke, using something like an exoskeleton in order to provide the therapists a more efficient way to retrain the person to walk and to to stand up and to ambulate and to be able to return to more of a normal lifestyle, or a lifestyle that is more mobile in both their home and the community, it affects society immensely, because the more the person is able to relearn how to stand on their own, how to walk on their own, and how to decrease the risk for falls, there is less return to hospital because of injury based upon falling. There's also a greater sense of productivity in the community and the environment, because they're more able to interact with their environment, to return to the community. One of the best feelings in the world is to have someone who we've helped become more mobile, become an ambulator again, come back to visit the rehab unit, walking on their own, and tell us stories about how they've been able to re-enter the community, not rely on other people to help them, to return to a state of feeling that they are a productive member of society and not just stuck in their homes or in a bed or in a chair like so many people have in the past.
Awesome. Thank you very much, Wade.
My pleasure.
Is there anything that you want to add on top of what I've asked you?
I'm very excited to see how the integration of technology and the human condition, especially in the physical realm, can help people become more than what they are at the current moment, whether it be injured, whether it become someone who can leap tall buildings in a single bound. I just really hope that anyone watching this does not have the domain name Skynet.